The ongoing strain in Canada's healthcare system is something that is being felt by many hospitals across the country. Joining me now for the latest on that is Dr. Katharine Smart, President of the Canadian Medical Association. Dr. Smart, thanks so much as always for making the time. Let's start out with that initial piece that I mentioned, the ongoing strain in Canada's healthcare system. I do want to talk to you, though, specifically about some of the privatization aspects of Canada's healthcare system. There's a press scrum that the Ontario Health Minister did just recently, where she talked about, how it's important to look at various options. Is that something that's a positive thing or a negative thing? And why do you ultimately believe that?
Well, I think it's really important in Canada that we maintain publicly funded, universally accessible healthcare. I think Canadians are quite clear that they're not interested in a two-tier healthcare system. And I also think the evidence shows that that type of healthcare system actually doesn't deliver better outcomes for the population. We believe that a healthcare system should be equitable access, and it should allow everyone to have the same access to care. Of course, that doesn't mean that our current healthcare system is doing that. We know that it's deeply struggling and that there needs to be systems transformation. But our belief at the CMA is that that transformation should happen in a publicly funded system to make sure that those changes and those innovations are available to all Canadians. I don't think we should be afraid of innovation and change. And I think sometimes our challenge in Canada is whenever we try to talk about changing the system, it becomes a discussion of private versus public. I think if we can all agree that one of the tenants needs to be publicly funded healthcare, then from there we can start talking about what changes and what innovations are needed to get things back on track.
And a lot of people, as you mentioned kind of the innovation to Canada's healthcare system. And oftentimes when that's done, a lot of people think about private versus public. But what are perhaps some new innovative ideas that, we could look at to address Canada's healthcare system that would not mean privatization, which is obviously something that a lot of people do not want to see?
I think one of the first things we need to decide is what do we want our healthcare system to be, and do we want a healthcare system? Right now what we really have is a universal insurance scheme that pays for physicians and hospitals, and we don't have an integrated system, and we're not using all the different types of healthcare professionals in a coordinated way to make sure that Canadians have access to care. So I think things like leveraging integrated team-based care, having everyone work at top of scope, improving interoperability of our electronic medical records and using data to drive accountability in the system would be amazing. We need, better planning around human health resources so we can take that pan-Canadian lens on what needs to happen and make sure we're planning for the future. We could decrease things like regulatory barriers that are preventing mobility of the health workforce so that healthcare professionals can show up where they're needed and support each other virtually. And there's also simple things like aligning the way referrals happen, centralized referral systems, for example, that can really improve access to care and make sure that the care people receive is more streamlined. So I think there's many things that we could be doing within the system, but part of what we need to do is commit to actually creating a system of care.
So then I guess I'm also just wondering what would your message be to someone who looks at, the current strains in Canada's healthcare systems, the shortages happening across the country and across many provinces and territories, and looks at privatization as a solution? What's your message to someone that thinks that?
Yeah, I think it's a great question. And I think what we have to realize is right now, one of the biggest strains in our system is the lack of human health resources. The system really is the people within it that deliver the care to patients. And if we think about, creating a parallel system, it's not going to do anything to help us with those resources. So I think what we need to realize is that we have limited human health resources. It's an area that we need to work on. Trying to spread them thin between two systems probably isn't going to work well. But we also need to then not be afraid to be innovative about how we use those resources, ensuring that the funding for the people in the system is coming from the public dollars.
And just lastly, just to conclude, your term as president of the Canadian Medical Association comes to an end on August 21st. I guess, ultimately, what are you most proud of during your time as president of the Canadian Medical Association as to the work that you have done in your capacity?
Well, thanks for that question, Wyatt. I've been really grateful, I think, for the opportunity to be an advocate for my colleagues, and physicians, and also other healthcare professionals, and for the system. I've been the president of the Canadian Medical Association during a really kind of incredible time in history, particularly when it has to do with the health of Canadians and the healthcare system. And I'm proud of the work I've been able to do to bring forward those issues, to try to educate the public, to try to advocate, and to try to ensure my colleagues have a decent healthcare system to work in. Because I know all of us are in this work because we care about serving others, we care about Canadians and their health, and I'm happy to have played a small part in trying to improve that landscape.
Okay, Dr. Katharine Smart, President of the Canadian Medical Association. Dr. Smart, once again, thanks as always for your time and best of luck on whatever is next for you.
Thank you.